How you doing, guys? So this is Dr. Suh at Specific Chiropractic. So we have a guest that flew over from Guyana, right? And in this video, we're going to talk about Brown Sequard Syndrome. And what that means is basically half of the spinal cord, okay, is paralyzed. So fill us in, how did that started?
Fell from a tree and get injured to the back of the spine. And at the time when it happened, I couldn't walk or couldn't do anything at the moment. So I just went to the hospital, and from onwards, that was about it. I started walking like 3 to 4 months after I started standing first, because the right side was still there, the toes, nothing wasn't moving, and continuously, like, I tried to do like exercises to flex the toes and flex the muscle, and eventually 1, 2 at a time start moving. So from onwards, I just mainly do like exercises to strengthen it, and eventually it just start coming back.
Gotcha. So
but because of the exercises.
So right now, on which leg you feel the most problem with?
The right side.
The right side. So what's going on the right side itself?
It's weak. The instep, as you could see.
Okay. All right. Like a
It's
gas
not
pedal.
flexing like this side.
Okay, so like a gas pedal car, press down. Okay. Press down. Okay. Press down. Press down. Press down. Okay, you got some weakness there. So which side you feel more weak? On the outside or inside of the foot?
I think it's the inside.
Inside.
Yeah,
okay.
because I get the balance more with this, the inner part.
Okay. All right. So other than the weakness of the leg, what other sensations you have issues with?
Only the feet.
Only the feet.
Yeah.
Okay. What about so you're saying off balance as well?
Yes.
Okay. Any other issues or a sensation, altered sensations you feel right there?
Well, since this side you would feel hot and cold.
Hot and cold.
And this side you wouldn't feel it, like from the knee down. You wouldn't feel the hot cold. It was the whole leg, but after this side start coming back, this start catching back. But only from the knee down, I wouldn't feel. If you put something hot or cold, I won't feel. But if you touch me, I'm gonna know that something is around my feet.
Gotcha.
But if you bore it, I wouldn't know that you're boring. Or if a rough or a soft thing come, I wouldn't know. But I would know on this one side. But I would know something is touching my foot or something is around my feet. Yeah.
Okay. Okay. So we definitely seen some feet coordination, and even your left foot is like you're walking on the outer edge of the foot. Okay.
Because maybe that's the part that's strong.
Exactly. So there's a lot of neural imbalance going on. This is the MRI back in 2021, all right? And this is where you mentioned about, okay, in the lower mid back region, when you fell out of the tree, you impacted.
Yes.
Okay. Now here's what I'm seeing here in terms of spinal cord. Okay. Now it should be a straight line, and also in the center over here. What I'm seeing is there's a lot of white signal right over here. So that indicates to me there's a possible cyst right there, or some kind of fluid right over there that's pushing the spinal cord along this way and irritating this region over here, putting pressure on there. That could explain why you have that hemiparalysis, that Brown Sequard syndrome going on over there, okay? And putting pressure over there. What I want to see over here, and I'm going to show that to the viewers and to yourself as well, all right? For your lateral X-ray, I did see an increased cavernous space in this region over here. This MRI confirmed my hunch as well. What I was seeing as well is this. I want to see which the spinal cord, okay, now even though spinal cord ends over here, you still have spinal nerves that are coming through this region over here. Sacral nerves will come here, and the coccygeal nerves over here, all right? ideally, just like this over here, right? I don't want, well, this one's a spinal cord. So once again, okay, there is no spinal cord in this region over here. It's only spinal nerves. I don't want to see those nerves reaching the top, the roof of this canal over here, okay, or the sides or the bottom of it. It should be smack in the middle, all right, floating in there. In this case over here, the space is increased. Now, part of the reason why it could be that way is this, okay? We have one huge sac that goes all the way straight up to the brain itself, okay? The primary purpose is to circulate that cerebrospinal fluid all the way straight around. Now, because of you have that cyst, okay, that fluid sac going on in the lower mid-back of yours, it may be interrupting and putting pressure over here and just like everything else, just like when you put a little, like you stepped over a garden hose, right? It's starting to build up some pressure over here, right? So this region over here is starting to get some pressure here as well. And these nerves over here also goes all the way straight down to your feet, okay? The sacral nerves are responsible for the outside of your foot as well, okay? And some temperature sensations and all that stuff, okay? That's part of it. So when we go to the x-rays, now because you have that trauma that happened in this lower part right over here, okay, which is pretty much right below the borderline over here, okay? There's some trauma that impacted over here. Look at on the AP film over here, okay? We have some increased space over here and rotation on that 11th dorsal. So that's something I want to keep an eye on. However, that being said, in the Gonstead method, we're looking at the full biomechanics. We're not just looking for a tunnel vision that says, okay, let's just focus just that area alone. Let's take a look, how's the foundation of your spinal itself doing? So when we take a look all straight down here, okay, this is supposed to be leveled like this.
Yeah.
You're sinking down on the right hand side. So when you're sinking down like this, right, we cannot walk this way.
No.
That's going to be an interesting challenge. In addition to, okay, we also have some interesting alterations going on in terms of your spine. Okay, it's also rotating like this way, and also you're pivoting in that direction as well. So in order for your body to compensate, it needs to go like rotating this way. And in essence, your body is trying to go like from here, trying to go like this way, and twist this way, twisting this way here again, twisting that way over here, this way, this way, that way, this way, and that way. There's way too much twist. We need to tackle this first. We need to level this. And considering it's so much down this way, with that external rotation or a PI ilium, I gotta figure out which one are we dealing with. Do we need to address your left hip? Do we need to address your right hip? Don't know. And we still also deal with how is this region over here, and that's also that cavern I was talking about before. This is a large sacral canal region right over here. I wanted to see what's going on in there, and the MRI confirmed it. I said, okay, it's just simply just a swollen, filled with fluid, white signal right over there. So no, we're at the green line. We're going to continue to proceed. However, we also have this second sacral segment over here. I want to confirm what's going on that one. Okay. Now the other component is that this segment over here, normal, it should be here. It shouldn't be like this. Okay. So we're going to find a way to stabilize and bring it over here and take the pressure off of this, because this over here, you're too much curvature like this. Okay. You're supposed to have a little more normal angulation like this way instead. So as a result of this, that's also what's putting a lot of pressure right in this region over here, and that's why it's also not letting this thing heal up properly. Even after all these years, almost 4 years, what, 3.5 years since that accident itself, okay?
Yeah.
So we're gonna proceed on. Let's take a look, see what's going on over here, and then we'll take a look, see what's going on here and here as well, okay? And then future visit will address everything else above. So with visualization, we want to see objective data, evidence of is there anything the body is trying to do to try to stabilize itself. So there's quite a bit of fluid and edema on the left-hand side, muscle spasm and tightness, trying to pull and stabilize something on the right-hand side. Now she's petite, so that's why I have to palpate here because they're much more subtle, but there's fluid right over here. Muscle spasms more so on the right hand side. Surprisingly enough, not too bad. See, there's a little pitting edema right there. Okay. But we could clearly see this. Look at that. There's a lot of fluid right here at that fourth lumbar level here. Okay, we got more fluid on the right hand side of the right SI joint here. Same thing, even more fluid right in the middle of it at the 2S level. Let's see, some on the 4S level over here, okay, on both sides, more fluid pooling over here, okay. So with this device right here, instrumentation, I'm looking for any signs of abnormal temperature in the region. Now when tissue gets damaged, it initiates an inflammatory response. And one of the byproducts, when it's trying to increase more blood supply, more vascular supply in the area, is gonna be altered heat. And right now we're just marking areas. It doesn't necessarily mean we're gonna adjust those areas. It just simply says, okay, we're gonna take a closer look on those areas itself. Let's see, what else? Okay, we got something way down there on that side. See how everything's staying to the left, all straight down? So we got possibility of some kind of core pressure going on. So it's even further up. See, we got core pressure. Keeps on going all straight up. Everything's staying 5 points to the left. And it terminates right there. No, that's not correct. It keeps on going even higher. Yep, all straight up. Way up, upper cervical. Yeah. Yeah. That's not moving on the right hand side at all. Pain right there?
Yeah.
Yeah. What about this one? Not too bad?
No.
What about this fellow right there?
Yeah.
Pain right at that fourth lumbar, right? How's this right there?
No.
Huh?
Not that bad.
That's your 11th dorsal. That's not moving too well. Feel that? I'm feeling right there, see?
Yeah.
That's the inferiority on this one, so that's part of the reason why you got some core pressure going on that way. But now we're gonna keep on tracing upwards, see what other core pressures we got going on here. So this one's kind of decent. Decent compensation that turned into subluxation over there. See, everything's starting to move decently. How's this? Pain right there?
Yeah.
On the right hand side?
Yes.
Okay, we're checking that atlas over there. Okay, I'm gonna check your upper cervical here. See, you got that AS occiput over here a bit. See, the atlas is moving. Okay, very, very slight fixation here. So that's a false positive, so we're not gonna mess with that. See, even this occiput over here, you have a slight, more like moderate fixation, that AS occiput. So what the battle plan is going to be is this: we're going to address the root cause of your problem, which is the foundation first. Start leveling that out, okay?
Yes.
And then we're going to take step by step and evaluate, see what's going on with that fourth lumbar and then the 11th dorsal and so on and so forth. So we could start taking the pressure off of the spinal cord over here. All right?
Okay.
Relax over here. Okay, come on up. Go ahead, walk around.
I feel.
Okay. Tell me, what do you notice that's different in there so far? How's your walking?
It feels slight. The waist here it feel light like.
Lighter? Okay. How's your walking itself? Do you notice any difference in there?
No.
Not at this time? Okay, fair enough. I just need some feedback. What about sensation? Any hot or cold temperature difference do you notice right there?
No.
Not yet. See that fourth lumbar right there? That's not a happy camper. And that left dorsal is still in trouble. Hold on. Right. Come on up. Go ahead.
I feel different.
Oh, where do you feel different?
I feel like I'm getting to lift the foot more.
Okay.
And walk. It feels different from before. It feel like I get to more like movements.
Okay.
Like I don't feel like I gotta like do the big effort to. It just feels different.
Okay. All right. Hey, that's a good start right there. You're able to lift your foot up a little more, okay?
Easy.
So, hey, that's great. How much better would you say right now?
Pardon me?
How much improvement would you say right now from 0 to 100% at this time?
0 to 100.
Yeah, how much improvement would you say? Ballpark.
Like 60.
60% improvement. Okay, that's pretty good. No, not enough in that fourth lumbar. Okay, we're gonna sit a little more deeper in this fall. Excellent. Okay, come on up. Walk around. Okay. What do you notice that's different with this one?
The motion in the way. Let me.
Your walking gait is already different. I just need to
Yeah.
know to let me
Walking
know.
is a little
Yeah.
slight different.
How to explain?
Well, you notice there's something different in there, right?
Yes, yes.
Yeah, even the mom I can
like,
see there's something
it's
different.
not curving in as much as you would curve it inwards
to
to
lift it,
step.
to move.
Yeah, so like I just feel like it instead of it curving like this.
It's going straight.
Yes.
Yeah.
You're not feeling the pull that I used to feel like when you step in. I'm feeling the pull, like how it used to curve like this. I'm feeling it.
Yeah, I'm seeing you're not circumducting your legs
No.
and your feet as much. So that's good progress right there. See, now that's why it was imperative to address the inferior and the fourth lumbar, because since her spine is so curved like this, normal should be like, or more like here. Hers is so curved this way, and it's biomechanically what it's doing is it's putting way too much pressure here. That could be a possible explanation. I'm not saying it is explanation, but it is a possible explanation why the fluid in the spinal cord here is not draining as well as it should. Okay, so that's why we have to adjust it, adjust it a second time for this fourth lumbar, get the inferiority out. And now we get to address this 11th dorsal here. This one is very inferior over here, and I need to set that very deep. Okay, come on.
Oh.
I know, I was very deep.
Oh.
Okay, go ahead, walk from out.
I feel like sleeping. my back feel more relaxed, like really relaxed. My back, it really feel it feel a lot relaxed. Like now I know that I had the tension in the back like before. How it feeling now, like it just light. I don't know. It feels good.
How's your walking?
I think it's because of the remember the lower part here in the muscle is weaker. But as before when we did the one before this, I noticed that it released like a tension in it first from curving or what's not. But I think the only problem is because it's weak that it gives me this lazy. But apart from that, at least I feeling better than before when I came, and I'm not getting that full. Cause when I walk, I just naturally used to feel at the foot like it curving. You used to feel that it's curving, that you know that it's curving.
Correct. You used to circumduct you used to swing your leg around a lot.
Yes.
Yeah, I notice you're not doing that as much.
No.
Yeah, that's good progress. Any other changes?
My back, it feels real good. It feels real good. Like I didn't even know that I had a tension in my back until you did that.
Okay. That's what I'm saying. Your spine, you're like here, biomechanical, your hips like this, and you have no choice but to go like this, you know. And so that's why I had to like steadily re-level you from here, get you a little more here. You're like fully upright here, but you're still like stuck like here a bit. And that's gonna need a couple more to try to bring you from this very severe position like this to eventually more like here. Okay?
Feels in my back, it feels really light than before.
Yeah. It's a great feeling, isn't it?
Yeah.
All right. I want to investigate, see what else is going on upwards as well, see what else we need to address. Okay. See, now what's interesting was that this was not fixated before. Now it's getting fixated because now we address this biomechanical issue over here. Now it's migrating upwards. So we do need to address the 6th dorsal over here. See, we still have a lot of reading at that level. And when we take a look below it, look at that. Instead of being 5 points over to the left, see, it's almost zeroed out. Wow, we still have this pressure right there. Okay, little relax the hands. See, things are calming down up here. We still have some reading up here as well. All right, so this leveled out. So we got that done. Uncrank that right here. So that's so in trouble this way. We have to address that one next, and that. Okay, boom, let's go. Let it go. Excellent. Now I am anticipating this side slip is going to reveal itself. And it did. It's right there. So we need to tackle this over here. See, the fifth cervical starting to come out now. And that's going to start affecting the upper cervical. Right there. Boom. There's the rest. Hey, how do you like that? No occiput fixation at all. Look at that, it's pivoting just fine. atlas, moving just fine too. All right, walk around. Okay, tell us what's different in there now.
Well, I feel like when you crack it, I feel
just.
like, yeah, a tension. I was feeling a tension like in the back, but like after you crack it, it kind of disappeared.
And that's good progress. How's your walking gait? Do you notice any other changes there?
Yes, I feel a lot better. I ain't really got apart from this side with the balancing at the bottom there, I ain't feel like I gotta take that big effort to step, you know. It just feels different.
Great, that's great. Okay, so this is a great start over here, okay? So what I want you to do is this, your homework is that you're gonna put a cold pack over there, right? And we're gonna let your body try to drain more of that fluid out of the way. See if it also supplies more nerve function down to your legs and the feet as well, right? Okay?
Yes.
All right, well, thank you for this opportunity over here.
Thank you very much.
This is a great start to your long journey over here. You're gonna continue that physical therapy and OT as well, okay? And we're gonna get you back on the right track from there.
Yes.
All right? Okay, all right, take it easy.
You too.
Okay, so when you go back to Guyana, okay, I understand the physical therapist over there, they're putting a bar weight, trying to have you a power squat, okay? Now, the reason why that's not a good idea is because this region of spine over here, what we just adjusted on you, that 11th dorsal, okay, it's very unstable biomechanically. Your whole entire spine is, like I said before, it's rotate, twist this way, left, right, constantly doing all those rotations. Normally, when something subluxates and misaligned, it's just simply going backwards and either rotates to the left or right. Your case is doing this extra double whammy going backwards like this. So because it's leaning forward backwards like this, and you put that weight, you're going to bend even more backwards. All right? It took a lot of effort and a lot of force to try to realign it because we're trying to push this ball bearing that went backwards. As we see over here, okay, it went backwards like this. We're trying to move this liquid ball bearing forward. That's not an easy thing to do, okay, especially in that case and with that trauma you experienced as well, which forced that backwards as well. So therefore, your homework over there, and you're going to coordinate with the physical therapist, I actually recommend a goblet squat instead, okay, or a sumo squat. Try not to put any weight bearing on the back of your spine. I'd rather have it on the front of your spine. So therefore, when you carry that extra weight, you do that goblet squat. See biomechanical what it does? So instead of it being on your shoulders where it forces you back this way, by putting the weight forward of you, okay, what it does is it's taking less biomechanical stress on the back of the spine, so it won't push out this way. You're gonna have a little more control and better function, and then try to preserve and protect that correction there as much as possible.
Yeah.
All right. So that's what your homework's going to be. You're going to do a lot of the pelvic strengthening. You're going to coordinate. We'll try to coordinate as best as we can internationally with your pelvis. I want this pelvis here, not this. Like almost like a tabletop here. That's causing too much stress and causing this huge arc over here. When it starts to get you a little more here, the spine itself got you from here a little more upright. And it takes a huge load off of this region over here. So that's going to be a long-term answer for you. And then the next time when you fly back here, okay, we'll proceed trying to rebuild biomechanical as much as possible. All right? Okay. We'll see you then.
Yes.